So when you start talking about what stigma means in a healthcare situation, or living in a community, it could be something related to your gender, it could be something related to your race, it could be something related to your ethnicity, or it could be something related to a medical condition that you have, like HIV. And so with HIV, it's a very complex issue because there's HIV itself, which sets people apart, or can, and then there are the associated behaviors, like we heard this morning, that are related to gender in particular, or in some countries drug use behavior, that layer onto that. And so there are what we call intersectional stigmas that are involved. And then because of stigma, where there's something different, people then act toward people differently in ways that are harmful or negative, and that's the discrimination part of it. And so together we think about stigma, which can be internalized or experienced, and then discrimination, which is the act that targets the person who is somehow stigmatized.
But we're in an age of so much information and people are aware about the disease, so why do we still talk about stigma?
That's really the big question, right? And I think it gets back to tolerance. And, people need to learn how to be tolerant of other people who are different than them. And I think we've learned in many situations how to address that. And part of what we try to think about when it comes to people with HIV is how can we address the different kinds of stigma and the different environments where stigma happens and discrimination happens, whether it's in the healthcare facility, which is the major focus of my work, but how that also plays out in the community, at home, and then one's own feelings about oneself.
Let's go to the healthcare facilities. What then is their role in helping to end stigma?
We're trying to work with ministries of health because this is a system-wide issue, that they then promote these kinds of activities in healthcare facilities to make them more welcoming and friendly for people. So if we reduce the stigma in the healthcare facility, we can also have some impact on internalized stigma or self-stigma, because if people treat me well and I feel comfortable, then I feel better about myself, and it can address that. The big challenge is, how do we link what's happening in the healthcare facility with what's happening in the community? And how can the community work link back to the healthcare facility? And so that's another big area to focus on, and how the information that somebody might talk about in a community survey or discussion, how that can be brought back to the health facility. And by the same token, how the health facility can provide better knowledge and information in the community.
My last question, would you talk a little bit about the U is equals to U campaign? Help us understand what that is and how it relates to HIV and AIDS stigma.
U equals U stands for undetectable equals untransmittable. And this is something that has emerged as an important piece of information and a campaign because of emerging knowledge that people who take medication and completely suppress their viral load so that it is not detectable when it's measured in the blood, that they cannot transmit the virus, okay? So this has now been shown in several studies, and it's become the official policy in many countries that it's part of our activities to reduce the transmission of HIV. If all we had to do was say U equals U, then boy, that would be great. There's a lot of things that have to happen to make U equals U work. And one is obviously spreading the information and the knowledge, and that means to providers as well as to people. But then really helping people understand, well, what does it mean to be undetectable? And you may have seen in the presentation that in some countries, when patients were asked about whether their viral load was undetectable or suppressed, as we say, they didn't know. So that means that their actions can't really be based on the knowledge about U equals U. So we have a lot of work to do about the literacy involved with understanding what U equals U means, if it will be successful. U equals U is a key step in preventing HIV transmission, but it doesn't prevent transmission of sexually transmitted infections, and it doesn't prevent pregnancy. So U equals U is one critical strategy, but we need to also think about how to prevent STIs in pregnancy.